Okay, I'm Krista. I'm a nurse practitioner.
Hello.
Nice to meet you. So today you're here for a breast exam, and I'm just going to go through a few questions, just a family history screening, just to make sure, just to assess your risk factor, essentially. Okay, so if we can just go through these questions. Did any of your first degree relatives have breast or ovarian cancer?
No.
Okay. Have any of your relatives had cancer to both breasts? I'm assuming.
No.
No. Okay. How about men in your family? Any men in your family have cancer, breast cancer?
No.
Okay. Any women in your family have, nobody has had breast or ovarian cancer. And so that includes before age 50, you haven't had any breast cancers. So no history. How about bowel cancers? Any colon cancers?
No.
Any cancers of any kind?
No.
No. Okay. Well, good. All right, so I'm going to go ahead and do a breast exam on you.
Okay.
We're going to start with your shirt will be lifted here.
Okay.
And so I just want to have you with your hands on your sides here. Good. And right now with the naked breasts, I would just be inspecting for any dimpling, any asymmetry. And then go ahead and lift your hands for me. Great. And then at this point, I would also be assessing for any dimpling or abnormal lesions, anything like that. Go ahead and put your hands on your hips for me. Good. Can you bring your shoulders forward? Good. And again, I see symmetry, no dimpling. Everything looks normal. I'm going to go ahead and assess your lymph nodes. Cervical lymph nodes, supraclavicular, and infraclavicular. I'm going to go ahead and check her axillary lymph nodes as well in this position, sitting up. Good. Okay. So when you're doing your own exam, I would have you go ahead and do those same positions in the front of the mirror. So you're going to do with your hands down. Go ahead and do that again. And then hands up. And go ahead and when you're looking in the mirror, I want you to assess to make sure that it all looks symmetrical and note any abnormalities. And then put your hands on your hips and move forward like that. Okay, so that's how you're going to begin your assessment as well. So at this point, I'm going to have the patient lie down. Go ahead and lie down for me. I'm going to have you I'm going to assess the right breast. And so go ahead and lift your arm up and put it just behind your head. There you go. All right, and with 3 fingers, I'm going to go ahead and start with the tail, rotating in small circles, and then progressively down and around. And this is also how you're going to do your own breast exams. You'll put your hand above your head like this, and then just go ahead and use 3 fingers and palpate in small circles all the way around until you've covered the entire breast, okay? And just note any kind of lumps, any abnormalities, any change in texture of breast tissue, any large masses. And then at the very end, squeeze the nipple for any discharge and note any abnormalities there. All right, you can go ahead and put your arm down. And at this point, I would go ahead and go on the left side and repeat the same, taking note to do the tail into the axillary and completely around the breasts and in circles. All right, any questions?
No.
All right, thank you.